Hi Mama, welcome back. I'm Dr. Emily, physician, mom, and your go-to guide for all things pregnancy. Before we dive into today's topic, don't forget, there's a list of baby essentials and labor-supporting products that I personally recommend in the description below. These are trusted, helpful tools that can make those final days of pregnancy and your delivery a little more manageable. Be sure to check them out after watching. Now, let's talk about pain. Specifically, the pain before labor begins. I get this question a lot. Where exactly will I feel pain before delivery? And what does labor pain actually feel like? Let's start with the basics. As your body prepares for birth, you may start experiencing a variety of sensations, some subtle, others more intense, and the type and location of the pain can vary widely from woman to woman. In the final days or weeks before labor, many women experience pelvic pressure or cramping, especially low down near the pubic bone. This pressure happens as your baby drops lower into the pelvis, a process called lightening. You might feel like there's a bowling ball sitting between your hips, and that's totally normal. You may also experience lower back pain. This kind of pain often wraps around from your lower abdomen to your back, and it can feel like a dull ache or even like period cramps. For some, this back pain intensifies as labor approaches, especially in cases of back labor where the baby is positioned in a way that puts pressure on your spine. Now let's talk about Braxton Hicks contractions, also known as practice contractions. These can feel like a tightening across your belly, and they might be uncomfortable but not painful. They don't come at regular intervals and usually go away when you change position or rest. But when real labor begins, the pain becomes rhythmic and progressive. Contractions get stronger, last longer, and come closer together. The pain typically starts in the lower abdomen, radiates around to the lower back, and may feel like intense menstrual cramps that build and release in waves. As labor progresses, especially during active labor, that pain intensifies. You'll feel it in the lower belly, the back, and sometimes deep in your pelvis or even in your thighs. The sensation can be sharp, burning, cramping, or a strong pressure. And during transition, the most intense phase before pushing, contractions can feel overwhelming and come back to back. And what about the moment of delivery, pushing the baby out? This stage often involves a strong, stretching, burning sensation around the vaginal opening, what's sometimes called the ring of fire. But here's what I always remind my mamas. By this point, your body is flooded with natural endorphins and adrenaline. Many women describe this stage as intense but purposeful, like the pain has a direction. Emotionally, labor pain can be scary if you're unprepared. But knowledge is power. When you understand why your body is hurting and how to work with it, through breath, movement, and support, it becomes something you can manage. You're not just in pain, you're bringing life into the world. Let's also remember that every labor is different. Some women feel more pain in the back, others feel pressure in their hips or thighs, some have quick labors, others have slow-building ones. And if you choose pain relief, like an epidural, that's completely valid and can make your experience much more comfortable. So mama, what should you look for as signs that real labor pain has started? Contractions that don't go away with rest, pain that's rhythmic and intensifying, a feeling of pressure in the pelvis or rectum, back pain that comes and goes like waves, the loss of your mucus plug or a bloody show, your water breaking, either as a gush or a slow leak. If you're unsure whether it's the real thing, it's always okay to call your provider or go in to get checked. That's what we're here for. Now, if you've already gone through labor before, I'd love to hear, where did you feel the pain most? Let's help other mamas feel more prepared. Share your story in the comments. And don't forget, those labor-ready products I mentioned are in the description below. From birthing balls to perineal spray, they can be lifesavers in the final stretch. You're doing beautifully, your body knows what to do, and you're stronger than you think. I'll see you in the next video.